Hi, Tam here. Let's talk about man boobs. Now, a dear friend of mine sent me a text on Messenger yesterday and asked me about man boobs. So he wants to know how to get rid of man boobs. So, this friend of mine actually is a doctor, right? And he says, "Hi mate, I have a fitness consult." So he frames it into a fitness problem, not a medical problem, right? So I'm assuming he's talking about lipomastia and not gynecomastia, right? So he says, "I have a fitness consult. I want to lose my man boobs. What should I avoid eating? Should I do cardio every day? How many minutes a day? Weights, meaning lifting weights. Light and many repetitions, or the opposite? Oatmeal, is it good or bad for you? Eggs, is it good or bad? Dairy, is it good or bad? Animal meat, is it bad? What's the best breakfast you can have? Thanks. Lots of contradicting evidence out there, spoken and searched." So yeah, let's start. What is man boobs? So you might have seen some guys, right, some people, maybe at the beach or public swimming pools or something. You have breasts. Mostly it's people who are a little bit overweight. When they move, the breasts are moving as well. You have to differentiate between the etiology of the condition, right? Now you have gynecomastia and pseudo-gynecomastia, otherwise known as lipomastia, right? Now talking about gynecomastia, right? And everybody tends to talk about gynecomastia as man boobs, but it's important to know the difference, right? You have gynecomastia and you have lipomastia or pseudo-gynecomastia, right? Now, talking about gynecomastia, right? Now, what is gynecomastia, right? Gynecomastia is the proliferation of glandular tissue. Lipomastia, right, is the growth of fat tissue. So your breast is fat. In gynecomastia, it's glandular proliferation, meaning the gland, the nipple, right, grows. So physiological gynecomastia, right, you hit puberty, you've got a hormonal imbalance, right? The gland, the nipple, the glands of the nipple are proliferating, are growing. And the nipple becomes bigger, swollen. And then, it increases in a concentric type of fashion. And it could involve the entire breast, basically. You get breasts. But it originates from the gland. In lipomastia, it originates from fat. You're overweight, you're fat, you're eating too much, you're getting lipomastia. So that's the difference between the two. Now, going back to gynecomastia, right? If it is physiological, as you hit puberty, yes, you might get gynecomastia. Like I said, it could last 6 months to 3-4 years, and at the end of puberty, it disappears. But if the gynecomastic tissue is more than 4 or 5 centimeters, you might be stuck with some gynecomastic tissue there. and then you will need surgery, right? Some kind of mammoplasty, or just to fix the problem, just to remove the excess, the excess tissue, right? So that's physiological gynecomastia. Yeah. Now, if you are an athlete using steroids, right? As you are using testosterone-based steroids, right? There will be some hormonal changes again in your body. All right. So these are the common etiological factors of gynecomastia, right? Now, it's important to note, right? I mean, it's important for you to know that gynecomastia can be bilateral, so it could be in both breasts, or unilateral. All right. Now, if you have a man boob on the one breast only, one important thing to do, I would say, is to consult a doctor. Right? Especially if you're a man past puberty, you're in your 20s or 30s or 40s or 50s, or any age basically, and you suddenly develop gynecomastia on the one breast only, right or left, it's important to see a doctor, because you could be suffering from breast cancer, right? So yes, you've got a man boob on the one side, on the one nipple, right? If it's very tender when you touch it, when you touch your nipple, consult a doctor. If you feel a hard mass anywhere in your breast, consult a doctor. If you see skin changes, but this is a late sign, right? But if you've been neglecting it, assuming it's normal, and now you see skin changes, you must contact a doctor immediately, right? If you have lymphadenopathy, meaning you get some swollen lymph nodes in the axilla, right? You must contact a doctor immediately. You could be having breast cancer. Men do get breast cancer, right? So these are things you must be aware of. If you were previously normal, and all of a sudden, you have a man boob on the one side, consult a doctor. Let your doctor do some few tests, just to make sure that you're not coming up with breast cancer, because breast cancer in men is a reality, right? Some men have gynecomastia, right? Both breasts, and they are lactating as well. It happens. So some men, some patients, right? They've got gynecomastia, they've got man boobs, and when they press on their nipples, right, milk comes out. They're basically lactating. Now, if that happens to you, if that has happened to you, or if that's currently your situation, you need to see your doctor immediately, right? Obviously, as a man, you're not supposed to be lactating unless you're pregnant, right? So if you have gynecomastia, even if you're fresh out of puberty, and or even if it's during puberty, right? And you are lactating as well, you are expressing milk when you press on your nipple, you must consult a doctor, because you could be having a pituitary tumor, right? So the pituitary gland is secreting prolactin. Prolactin is what gives what gives women. It's what enables women who are pregnant, who are post-pregnancy, who are breastfeeding, the ability to express milk, right? So as a man, if you're lactating as well, then it means that you have a prolactin imbalance, a hypersecretion of prolactin, you might have a pituitary tumor, and that's a serious issue. All right. So see a doctor. Let them have a CT scan of your brain or an MRI of your brain. Have a good look at your pituitary gland, and if you have a tumor, let them take it from there.